A far more common type of study design is called a retrospective study. Retrospective means that the people were already treated sometime in the past, and then the doctor decides to look at the results that occurred. So the medical charts are reviewed, information is extracted off of those charts, it's tabulated into a computer, and some effort is made to try and compare the results of one retrospective study with those of some other study done on a different population of patients. Now, the retrospective study design is easier to do. It's far less expensive than a prospective randomized controlled trial. But the main problem is that the information may be inaccurate. It may be incorrect. And any conclusions that are made based on a retrospective study are open to question. The bottom line is you cannot make strong, firm conclusions about retrospective studies. So if you're trying to compare two different treatments and they've both been based on a retrospective study, maybe they are similar, maybe they're not. But there's no way to tell unless you design a new study. The retrospective study, because they're easier and less expensive, are the most common type of studies that are reported for people with prostate problems. And you need to be aware that this is a limitation. So if you hear the results of a retrospective study, or let's say you hear the results of a study, you should find out if its design was retrospective, because if it is, you can go away from it and realize that the information may or may not be correct, and there's just no way to tell for sure. The best information we can get from a retrospective study is it may seem like treatments are similar, but they will need to be tested formally in a new prospective randomized trial if you really want to know for sure.